line there, and I think they're ready. Okay, reactions and effects of Gardasil resulting in extreme trauma, or REGRET as it is acronymically known, is a support group set up for parents of girls who have suffered devastating and life-altering adverse side effects following inoculation with the HPV vaccine. Anna Cannon is their official spokesperson, and she joins us on the line now. Good morning, Anna.
Good morning. Thank you for having me on.
You're very welcome. Anna, maybe you just explain, first of all, the HPV vaccine, or Gardasil. What is it?
Well, the HPV Gardasil vaccination is a vaccine that is an STD, a sexually transmitted disease vaccination for 4 strands of the HPV infection. There are several hundred strands of possible HPV infections that can lead to cervical cancer. This vaccine protects from 4 strands. It isn't proven to last longer than 8 years, and 95% of the 4 strands would be cleared by a healthy immune system itself. So there are several angles on the benefits of this product as well that we need to look at very closely when we're taking a decision in regards to our children receiving the vaccination. The vaccine has a patient information leaflet that comes from the manufacturer. It outlines the very important risk information, and in that it lists 25 plus possible side effects. But parents in Ireland signing up for the vaccination don't get access to this risk information. Instead, we get a leaflet from the HSE which will give us 5 possible on-the-day reactions, which is advised that it can be treated with paracetamol or ibuprofen. So now we have a situation in regard to where we represent 360 chronically ill girls, all healthy, vibrant and sporty, leading up to the vaccination, and who all present with a mirrored list of symptoms that are also listed in the patient information leaflet as possible side effects of the vaccine.
Okay, now I'm going to ask you the possible side effects, because we normally expect a side effect from a vaccine or from any medication, to be something that's very short term and, possibly at longest a couple of days. But these have been life-altering side effects or indeed conditions now that have come as a result, or you believe as a direct result of the vaccination.
Yes, because we have girls that suffered with instant seizures within minutes of the vaccination. So there are cases where the reaction is immediate. We have girls that suffered with instant seizures, were left on the floor, on a school floor for over 45 minutes, where ambulances were not called, girls were not looked after, because this is rolled out in the schools, in the GP hall instead of in the sports hall instead of the safe environment of a GP's office. There is obviously a risk associated with that, because we know that faintings, for example, is something that is listed as one of the more common reactions. But
sorry, Anna, can I just interject? This was an immediate reaction following the administering of this injection, that somebody fell onto the school floor or the hall of the school and started to take a seizure?
In immediate, yeah.
And that was deemed acceptable. How would somebody know that the seizure wasn't related to something else, that there wasn't another underlying condition, or indeed we know that epilepsy can come on at any stage in someone's life? So
absolutely. All the girls, there is a timeline here where we have perfectly healthy, sporty, vibrant girls who go on to receive either first or second, or in my daughter's case, the 3rd vaccination. And we call it symptoms, post-Gardasil symptoms, if we want to call them that, come on very close to the timeline of the vaccine, and then develop and add it on to as time progresses, because a lot of our girls are now suffering with autoimmune conditions as well. It means that their immune system is effectively attacking itself. So, we're talking about things like seizures, chronic severe daily headaches, muscle fatigue, paralysis. We have several girls in wheelchairs. We have girls with early onset of menopause, ovarian failure at the age of 16. A group of these girls who are also suffering with the other listed side effects. We have girls who are in constant pain, acute and ongoing recurring pancreatitis. They have gastrointestinal problems. They have neurological problems. They have heart problems. They suffer with short-term memory loss, concentration problems, sensitivity to light and noise, and also, of course, being in that very sensitive age group, there is a psychological aspect of this where we've several or many of our girls are now being watched very closely for increased suicide risk, because you can imagine when you have a child that age who's suffering for 5 or 6 years, being going through the merry-go-round of doctors dismissing them, being told that it's all in their heads, being neglected by the educational system, not getting access to help from the HSE, being demeaned by the Minister for Health publicly, it has a consequence.
You've obviously you actually answered, I suppose, my next question in there somewhere, because you said being dismissed by doctors. You now represent 360 girls, and I'm wondering, have all of them being dismissed outright by their GPs?
We have a number of GPs who are very clear on their they feel that there is a connection with the Gardasil HPV vaccine, but they are afraid to speak out publicly because, as we know, speaking out publicly can mean that your license is revoked, that there is legal consequences. But they are very clear with us in terms of treating the girls that they do feel that there is, a coincidence. Looking at the coincidence argument, there is an article today in the Irish Times where one of the doctors involved in the TV3 documentary as well, who represents NIAC and working closely with the HSE, is again publicly dismissing all these girls. His argument is that they all have chronic fatigue, that it would have happened anyway, and that it is a coincidental. But this is being done knowing that these girls have a list of a cluster of identical symptoms, also mirrored by 10,000 of kids worldwide who have one common denominator, and that's that they received the Gardasil vaccine. So
we'll get to that in a minute, because there are worldwide cases now. I know that they've said that there isn't enough evidence to suggest there should be an investigation, but I don't know how they can turn around and say that that there's no evidence to prove it if they haven't had an investigation. It does seem slightly contradictory.
Yeah, it's very interesting because, we have a group of 360, so effectively that's 1 in 600 out of 200,000 girls vaccinated, so it's quite a significant group in terms of casualties. But the more interesting thing is that the HSE have been very clear with us that they are not open to looking at any possible connection with the Gardasil vaccine. And we would question why, because, I'm very open to the possibility that an investigation is taking place and we're looking at the root cause in order to provide these girls with some form of tailored treatment plans with the objective of restoring their health, if that is going to be possible. But if you're not going to look at the root cause, whatever that may be, it's very hard to figure out how you're going to come up with a solution. And I would question that. And I also question, of course, why parents are still not being given the true picture of the risks associated with this vaccine. Every parent have a legal right to get the patient information leaflet before you sign up for this procedure.
Anna, you were one of those parents. Were you presented with any of these possibilities, these scenarios, before you permitted your daughter to have the vaccine? No,
in my case, my own mother died in cancer, so it was a very clear cut. We were all very excited about a potential cancer vaccine, and when we received a glossy brochure that says, do you want your little girl to contract cervical cancer? Of course we don't. But we're also told that these are the only 5 possible reactions that can happen related to this vaccine. So I trusted the HSE. I trusted that the information given to me was correct. And it took me, my own daughter was 13. She was very unfortunate because she received 3 injections of the vaccine, and she took ill after the 3rd vaccination, and she is 18 today. It's actually a very emotional day because it's her graduation today. She has missed 3 months of school now completely. She's been doing 2 or 3 days, half days, hours here and there in her leaving cert year, and she is now looking at another failure of not being able to achieve close to the points that she would need to achieve her dream. She was a very healthy, sporty, happy-go-lucky, very liked girl by teachers and peers, and she's now a chronically ill girl with systemic inflammation, daily severe headaches, muscle fatigue, extremely fatigued, heart palpitations, ongoing stomach problems, acute pancreatitis. She's been hospitalised 5 times on very long stays. She's been seen by 20 to 30 consultants, none of which have reported any of the concerns that we've had around side effects for her. And she's in a very bad place now emotionally, because she's also been isolated in school as a consequence. She has no friends. She describes it as living in a dark room with the door locked, watching through social media what other activities what used to be her friends are enjoying. And I'm extremely worried for her, and she's my pride and joy, and I don't know what the future holds for her. I don't know if she's going to have problems with fertility. I don't know if she's going to be on potential disability allowance for the rest of her life. I don't know if she's going to be able to go to college. I just don't know, and I'm one of a large group of parents with 360 girls who are many of which are in a much worse place than Molly also. So, when your previously healthy child is left in a wheelchair, or left with 6 seizures a day and injuring their head and knocking out teeth as they fall and injure themselves, it becomes the pressure is extreme on parents and families, and we're exhausted. We're trying to support new parents coming on board into Regret as well, and doing the job that the HSE should be doing. And I don't understand how the HSE never put in place a plan for. We all know there's going to be, as you said, side effects from any medication or vaccination. Why it was not put in place for these kids?
Well, temporary side effects, as we said, Anna, not these devastating and debilitating side effects that are just.
And by the way, in the manufacturer's own patient information leaflet, it tells us it lists side effects, including the very severe, seizures, for example, would be one of them. It says, if you experience any of these symptoms, even several months after receiving the vaccination, you should contact your healthcare provider immediately. Now we're being told that there are no long-term side effects. Which is it? Which patient information leaflet do we believe? Do we believe that the HSE is providing us with the correct information, or do we trust the manufacturer is giving us the correct information?
Look, Anna, I just want to mention that, you mentioned those 360 girls now at the moment, and that this is, I suppose, early days, and Regret is only highlighting this issue now. In Denmark, there's more than 1,800 girls. There are cases in Japan, in Italy, and there have actually been 89 settlements in the US.
Yes. And I mean, there are lawsuits all over the world right now. 89 settlements, as you said, outside of the US. There are ongoing lawsuits in France, Italy, Japan, Australia, India. There was a study out 2 weeks ago from Canada where they followed 950,000 HPV vaccinated girls, and 1 in 10 presented in an A&E department within 42 days of receiving the vaccination. This is a worldwide problem, and it's not being acknowledged by the Irish government. It's an international problem. We have a duty of care for these girls. These are very sick girls. And someone is going to lose their life. We had a 13-year-old girl who died in the UK 2 weeks ago within 5 days of receiving the vaccination.
Okay, people can take what they want out of that. Well, now, I do know, because we mentioned settlements and 89 cases in the US, when they're far more litigious than us anyway. But, in addition to what you're living with here, there are financial implications for you and for the other families that are struggling. And a lot of these are families on very, very low income. I know some have suggested that they have spent 20,000, and in the region 20,000 on treatments. And of course, none of this is covered by the HSE because they're not recognising the condition in the first place.
And that's only one part of the problem. I mean, on a more basic level, we can't get medical cards for the girls. I am now in a situation personally, and I have many families like myself in Regret, where I've spent over 20,000 euros over the last 5 years to try and find treatment, medical health, insurance, cater for her daily, improvements in her life so that she can function, holistic treatments, supplements. The list goes on, and now I'm in a situation where I can't get a medical card. Families are waiting 8-9 months for a medical card. Now she has, on top of her symptoms, an intracellular bacterial, very serious condition which has developed, and the fact is that I can't afford to treat my child because I cannot get a medical card at the back of a state-enforced vaccination programme. And so you would have thought that these girls would have got discretionary medical cards, disability allowance, carers where needed, basic things. And then, of course, I mean, it is a huge issue where you've spent €20,000 over 5 years and there's nothing left. I mean, I have 2 special needs children as well. I can't access services for them. I can't barely get to the hospital when I need to because I don't have money for petrol. You know, how to the bones it's got for parents.
Anna, I've got to cut across you there because we're running out of time a little bit. But don't take it personally, by the way, with the HSE, because they have a history of utter contemptibility when it comes to patients and medical cards, and we know that. Look, getting back to where we came in, and this is something we will take up again. This vaccination, you said, is administered to prevent STDs that possibly can ultimately lead to cervical cancer. Would it not, and I don't know, maybe it seems a very simplistic scenario, but would we not be better actually educating our daughters with regard to other methods of preventing these STDs, as in, you know, safer sexual practices rather than just sticking a needle in them? And I know that may seem very, very simplistic, but is it an issue that the schools don't want to engage with that, so it's easier to pass it on to somebody else?
Yeah, I mean, a specific STD here is the HPV infection that we're looking at, and I mean that could be prevented by, for example, bringing smear testing lower down in ages. Smear testing is very effective in detecting this at an early stage, and it has been acknowledged that this vaccine does not exclude smear testing, so these girls would have to be smear tested anyway. So why not bring it down in ages and, as you said, increase the sexual education, because we know that it's 100 times higher risk based on the manufacturer's information to the serious adverse events than it is to contract cervical cancer.
Yeah, and listen, I've never heard of anybody, contracting any side effect from engaging in safe sexual practices. Listen, Anna, I really do thank you for talking to us this morning, and I know it was difficult on a day when you said you should be celebrating the beginning of your daughter's adult life, the day of her graduation. You are having to take a phone call from a regional station and lay your story bare for the benefit of our listeners, but I do hope it is to some advantage to you and your organisation. Just if anybody out there listening is identifying with this, how do they get in touch with you, Anna? Yeah,
we're on www.regret.ie, and you have a multitude of information there, including contacts, etc. So it's regret.ie. There's a lot of information and very good support systems in place if your child is suffering from any of these unexplainable conditions following the HPV vaccination, and you want advice or help or support, contact regret.ie, and we'll be there for you. Okay, Anna Cannon, thank you. Thank you.
97.7 Dundalk FM Town Talk.
What's on your mind? We'd really like to hear.